Welcome back to Kentucky Newsmakers on WKYT. Hopefully by the end of this program you will have learned a lot about healthcare in Kentucky. Joining us now is the author of a study about the healthcare market in our state, including access and what people spend to take care of themselves. Dr. Alison Davis prepared the report for the Foundation for a Healthy Kentucky. Dr. Davis here from the UK College of Agriculture. Welcome. Good to see you. Appreciate it. What did the study attempt to identify?
It was a very comprehensive study. It had a lot of goals. One was to really explore access to health care at hospital level, at the clinic level, at private practice level. The other was to look at trends in healthcare spending, in Medicaid and Medicare eligibility. And the final component was to look at the economic importance of healthcare in Kentucky, something that is often overlooked because it serves such a vital role as making Kentuckians healthier.
It's also big business.
It's a big business.
Yeah.
It's a very big business, yes.
What are your findings about access to health care, and what makes the difference? Is it socioeconomic? Is it geography?
It's a combination of all of those two things. Yeah. The rural areas of Kentucky tend to have less of access to the types of services that we might take for granted in Lexington or Louisville. A lot of our rural areas have access to hospitals and clinics, but they tend to not have access to specialists. So they'll use a hospital for an emergency situation, or they can have access to primary care, but because our Kentuckians are not as healthy as we want them to be, when they have needs for diabetes treatment or for cancer treatment, they often have to leave the rural areas to go to the bigger areas to seek treatment.
And I know your study, it probably sort of drew some conclusions like that, but it didn't really say what to do. But are there some areas of improvement that you see from that? I mean, we hear all the time that a lot of doctors, say from Lexington or Louisville, travel out into those rural areas a day or two a week.
They do, and there are some great efforts to try to get some physicians to come in part-time, 1 day a week, 1 day every 2 weeks. There's a lot of emphasis both by UK and through the cabinet to try to think of ways to creatively recruit and retain physicians to these rural areas. There's a certain quality of life that's really quite quaint and to try to market these rural areas as places where you'd want to raise a family, where the education's good, where there are things to do on the weekend and so forth. But it's always a challenge. There are programs in place where some medical students can go to rural areas and get their medical loans repaid, and so there's a lot of talk about that in the future of how to create incentives that will attract some of these healthcare providers, not just physicians but nurses and so forth.
Are there programs in place to get people to get a certain part of their college paid for, their medical schooling paid for, if they will return to
Absolutely. There's the Kentucky State Loan Retention Program where the federal government and UK will pay half of the loans, and then the provider who the physician is working for will pay the other half for a 2-year program. So there are some things out there. I think it's growing. And the need certainly exists.
I saw in your study, and it's a pretty thick one, by the way, I have it here, occupancy rates in some of those rural hospitals at less than 20%. Is it hard to operate a hospital in rural Kentucky?
It certainly is. I think the hospitals serve a very important role. And a lot of times there are some very small hospitals that by the federal government are only required to serve the patients for a certain amount of time. And so you will see some patients who have to bypass, is what we call it, the local hospitals to receive care at the bigger city hospitals. We're working with the hospitals right now. They're now mandated under the Affordable Care Act to do community health needs assessments. And part of that is to better understand and to communicate with the communities about why it is they're not using their local hospitals for services that they actually do have. And so we're finding out some really good information. The hospitals, all of them who are nonprofit, have to report back their strategies from once they hear the needs of the communities discuss. And so I think over time we're going to see some of those utilization rates go up.
You can look at, you'll just see numbers and then you read things into them, but you also looked at the large number of disabled workers in Kentucky. Why does that happen, Dr. Davis?
Oh, well, I'm not going to go too much into why it happens, but it certainly is an issue. In a lot of our rural areas, we do have high rates of Social Security, SSI, and disability, and that has great impacts. I mean, it's a drain on our medical system. It takes people away from working who could be working, and I know it's it's important to both the President of the United States, who I've relayed this message to through the Appalachian Regional Commission, where this is a very important issue, to try to figure out ways to incentivize people to understand that working is a great option. And with working now with these health insurance exchanges and with the Affordable Care Act, that there are some additional health insurance that might now be available, so it might be more attractive to work, as opposed to sometimes, and I'll just say sometimes, misutilizing the SSI disability services that are out there.
If people want to know more about your report, the 2012 Kentucky Healthcare Market Report, and like you said, it really is comprehensive.
Yes.
And covers a lot of things. And as you know, the months that you worked on that,
Yes.
how can they get some additional details about it?
Well, there are a couple ways to do that.
Yeah.
One will be through the Foundation for a Healthy Kentucky, because they did fund the study. The other is that it will be on the College of Agriculture at University of Kentucky's website, and it was also on our website, which is CEDIC, the Community and Economic Development Initiative of Kentucky.
What conclusion do you draw at the end of all of this work about the state? Just a couple of sentences about where Kentucky is.
Well, as an economist, I have to say we've got demand and we've got supply issues right now, and there's going to be a tremendous increase in demand for health care as a result of ACA, and our supply of providers, both through retiring physicians and through changes in legislation that may make it less attractive to practice, means that we've got some serious equilibrium that we've got to get to soon.
Kids study science, right?
Yes, yes.
Dr. Davis, thank you. We appreciate it very much.